Hello everyone, greetings from Maa-Si Care Clinic. My name is Dr. Tanima Singhal and I have 12 years experience in Obs and Gynae. My graduation is in Ayurveda and post-graduation in Reproductive Child and Health. Since 3 years, I am practicing as a childbirth educator, pregnancy educator, Garbh Sanskar expert and lactation consultant at Maa-Si Care Clinic, Vikas Nagar, Lucknow. We take offline and online consultations as well. Today's topic is how to start complementary feeding for babies after 6 months. So today we are going to talk about that mothers usually have this kind of issue that first of all they want to ask that what is the correct time when we speak. 6 months means starting of 6 months or completed 6 months. So first you have to understand completed 6 months means now that is the time to start complementary foods, solid foods which we call as. So after when the baby completes 6 months, then the complementary feeding has to be started. Now, how much, frequency and amount, this is again a big question. So when the baby completes 6 months, then start with 1 tablespoon morning, 1 tablespoon evening on the first day. On the second day, 2 tablespoon morning, 2 tablespoon evening. Third day, 3 tablespoon morning, 3 tablespoon evening. Fourth day, now it has to be 4 tablespoon morning, 4 tablespoon evening, and now this is the maximum limit. For 4 tablespoon morning and evening, it should be continued for this whole month. Now, next question is what should be the consistency of the food? So consistency of the food should not be runny, which we most of the times we hear from our mothers that I have started giving dal ka pani and rice water and mashed potato, suji kheer. So we are not supposed to give these because they have no nutritional value. Because it being very runny and baby's stomach capacity is very less. So if you will fill it with a lot of watery food, it will not give the correct nutrition required for the baby. So the consistency should be a paste like which does not fall from the spoon easily. When we are just tilting the spoon, it should not fall off easily. So that will be the consistency of the food which has to be given to a baby. Now, when we are talking about nutrition, what should be given, then the mother should understand that she should give diverse nutrition. Diverse nutrition means that from the different food groups. So the 3-day rule has to be followed. Like one food item which has to be started has to be followed for 3 days so that we come to know is there any allergy with the food, so that she can understand and she can write down and she can maintain a food diary also. So suppose she feels that with any particular food item my baby is not suiting to that particular food item, so you can just write it down in your food diary and just try it again after 1 month or 2 months and then see if the same symptoms or the same problems occur again. That means you are clear that the baby is allergic to that particular food. So this way the maintaining the food diary will always help. Now, diverse nutrition, as I told you, it should be from different groups. You can start with like different grains, especially millets. They are very good for the baby for giving a good nutrition in terms of macro and micronutrients. So, food groups like your grains and along with millets, she can also give whole grains. Whole grains have good fiber. So the babies, or this is a very common problem that the babies are constipated. So if they are given good whole grains, that will help the bowels to maintain proper. It will be good for the baby. So from the grains group, and then from the vegetables group, from the nuts group, from the seeds group. So this way different food groups should be taken in consideration while planning the diet chart for the baby. Now, then comes a very important role of water. Water should be given in considered quantity, because if you give lot of water to the baby will fill her stomach with water and will not eat properly. So how much water is advisable? It should be given 4 tablespoons morning and evening. This is a required amount, that is around 60 ml. What you can do, she can measure that 60 ml of water, and whenever she is giving water in the whole day, she can give it from the same amount where she has stored that 60 ml, measured and kept it that 60 ml. She can give from that, so she knows that the baby has taken 60 ml of water every day. Now next thing is when we are talking about, yes, now first month, like 6 months completed, mother should ensure that she should give around 8 to 10 food items from the different food groups, as I already mentioned. She should try to give at least 8 to 10 food items in the first month itself. Now she can mix and match. For example, from day 1, if she started moong dal, then after 3 days of following the moong dal, she can add a different food group item, like she can add palak into that. So that will help the food to become more diverse. So this way she can keep adding into that and keep replacing the food items. So that will be a mix and match, and that will give a good diverse nutrition to the baby. Now 3-day rule, I have already mentioned that every food item should be given for 3 days to check whether it is suiting to the baby or not. So mothers reach out to us for different kind of queries related to child nutrition, and if you are one amongst them and you have any kind of queries regarding your child nutrition, then you can reach out to us. We will be happy to help. We plan out the customized diet charts according to the baby's growth parameters, and we guide you on a holistic nutrition which is very good for the development of the baby. So hope you like the information shared. If you like the information shared, please share this video and like our channel and subscribe to our YouTube channel as well. Thank you so much. Have a nice time.